Thank you.
What this is venous side of his heart, taking out all the venous blood going to his heart. His heart is beating, but it's not doing him any good. It wouldn't have to beat if we were going to open it up and it'd be all right. The circuit through these two, what's the venous pressure? All right? Down. That helps, John. Get on the pump now. Get on the pump. Right there, out, don't forget to press that on. It's like actually just like all the rest of them did.
The greatest need, as I see it, in the field of the care of the mentally ill is for additional personnel, particularly registered nurses. The shortage of nurses in this field is not peculiar to the state of Alabama. It has been estimated that roughly 50 out of every 100 hospital beds are occupied by patients who have mental illness. It is said that less than 2 out of every 100 practicing registered nurses are taking care of these large numbers of psychiatrically ill patients. Here at Bryce Hospital, we have about 1 registered nurse for each 160 patients. If we could come up to the recommended standards, we would have 10 times that number of registered nurses. It is hoped that if the bond issue is passed, with the addition of training facilities, with the expansion for experience in psychiatric nursing and psychiatric nursing education, that interest in this field will be increased and that additional registered nurses will become interested enough in it that they will want to enter the field of psychiatric nursing.
I feel that the personnel of the hospital are to be commended for the good job they are doing with the available facilities. They are handicapped by lack of room, inadequate facilities, overcrowding, and insufficient personnel. The crying need is for additional doctors, psychiatrists, registered nurses, and for facilities for rehabilitation of those who have hope of recovery. We need a crash program in personnel training and application of latest technique and methods in efforts to increase the number of recoveries and reduce the length of stay at the hospitals. From the expression of the members of the legislature who toured the hospital with me and saw the need, I am confident that the legislature overwhelmingly will raise the necessary money to meet these critical needs.
Patients who are referred to the hospital for possible admission will be seen first and screened as to whether they are valid candidates for admission by the psychiatric staff of the hospital. This includes the visiting and attending men as well as the full-time faculty of the medical college in the psychiatric department. We hope that this hospital will reduce the admission rate by half to the state hospitals. Of course, the farther the source of patients is from Birmingham, the lower the figure perhaps will be, but we hope to cut the total rate of admission to the state hospitals by 50%. Yes, sir, there will. We don't know exactly how many yet, but there will be definitely beds for indigent patients. Technically, under the law, they could do so. Those who are too sick, obviously, to go home, if they insisted on leaving this particular hospital, would require formal legal commitment procedure to one of the state hospitals. We will, of course, in this hospital need some beds which are behind locked doors, but we hope that most of this hospital will be what we'd call an open-door hospital. Well, we say emotionally disturbed children, and by this term I guess we mean children who are so seriously disturbed that they can't get along at home and in school any longer. Most of these children have nothing physically or organically wrong with them, but we expect a certain number of children who have had brain damage, who are cerebral palsy children, some probably who are mentally retarded and who need to be hospitalized for diagnostic purposes or for brief treatment. We hope to have some facilities for receiving alcoholic patients who require hospitalization. Of course, all alcoholic patients do not require hospitalization. Some do desperately, and the facilities for hospitalizing such patients are terribly inadequate at the present time. Well, since our program was accredited for graduate training in psychiatric medicine, we have only trained 6 to their completion of their training, and of these 6, 5 have remained in Alabama. Only 1 has left the state. I suppose you might say primarily for psychiatrists and psychiatrists-to-be, but we certainly will have training facilities and resources for psychiatric social workers, clinical psychologists, psychiatric nurses, and perhaps other professional groups who work in this particular area.
Thank you very much.
Nationwide trend is for the treatment of psychiatric patients in general hospital settings, and I think Alabama is showing its intention to follow that trend. I think in the future we'll see more and more psychiatric patients who are treated adequately close to home in general hospital units.